It's a pleasure to welcome back to the program Gerald Friedman, professor of economics at my alma mater, the economics department at the University of Massachusetts. We all saw this Wall Street Journal article, which was very provocatively titled, and it pointed out the huge expense of all of Democratic presidential candidate Bernie Sanders' ideas. And the article talked about what you had written regarding the cost of Bernie Sanders' proposals, but it was deceptive in that it only talked about the costs and not the savings. So let's start sort of at the very beginning. Talk to us about the analysis you did about Bernie Sanders' proposals.
Okay, well, I've done two analyses. The first, which is the largest program he has, is the single payer national health insurance program. And that one accounts for $15 trillion in increased federal spending over the next 10 years. Then there are seven other programs that he's proposed that come to $4 trillion over the next decade. Taking the healthcare one first, the article in the Wall Street Journal highlighted $15 trillion of spending. Oh my God, that's a huge number. But think of it this way. We pay for healthcare out of two checking accounts. One of them, the public sector, pays for about half of our healthcare spending. And over the next 10 years, through Medicare, Medicaid, the Veterans Administration, and various other programs, we'll be spending $20 trillion out of that bank account. The other bank account is, you could think of as private taxes, taxes that we pay the health insurance companies for healthcare. And over the next 10 years, that will be $20 trillion for a total of $40 trillion coming out of our bank accounts. That's the money that we're spending on healthcare over the next 10 years. Now, if we adopted Bernie Sanders' proposal, or something like it, we would be spending $35 trillion out of the first bank account instead of 20. That's where they get the $15 trillion. But we wouldn't be spending anything out of the other bank account. So in total, we would be saving $5 trillion over 10 years. And they want to highlight that we'll be spending more out of this bank account. But the real issue is that we're not spending as much on healthcare because the healthcare system would be more efficient. And in addition to spending less money, we would be covering everybody. And there would be no copays and no deductibles. So we would be getting better healthcare for everybody and saving $5 trillion.
Well, this is a sort of common technique that we often see by those who claim to be sort of amorphously about small government, which is they'll look at a program and they'll say, here's what it costs, and it ignores what it saves. And in my mind, it's sort of akin to saying, hey, it would cost me $1,000 to make my home more energy efficient. That's $1,000 more than I could be spending. And it ignores that maybe you'll save $50 a month on heating your home and you've got a 20-month payoff. It ignores one side of the ledger, so to speak.
Exactly. The same for some of his other proposals, like infrastructure. We would be spending some more money up front on fixing the roads, improving airports, building mass transit, promoting solar energy. And then we would be saving money. Just retrofitting federal government buildings would cost money, would create jobs, and would save money, exactly like what you were talking about. To talk only about what we'll be spending without talking about the money we'd be saving, money that we would have spent otherwise, is, I find, misleading. The other proposals, by the way, would all the $4 trillion in extra spending for universal pre-K, college, etc., those would all be replacing other money that we're already spending and replacing some tax expenditures where we subsidize people to do things privately that the government would be taking on, and would generate more jobs and more economic growth and more tax revenue.
And when we look at programs like pre-K, for example, or more generally, government spending on education, there's the sort of savings we can measure in the way that you're talking about, but there seems to be a whole other area that's a little bit more difficult to quantify, which is the sort of savings via the positive long-term social impact of starting education earlier, or
Yeah.
the long-term impact of, if we have universal pre-K, 20 years later, how many fewer people on welfare do we have as a result of jump-starting education? That I'm sure exists, but it's difficult to quantify, isn't it?
There is a literature on this because we've had Head Start for long enough that we've been able to follow kids who were in Head Start in the 60s and 70s and go along. And what you find is exactly what you say: lower rates of crime, better jobs, better social outcomes, and less time spent on welfare. All of these are savings in the future. In my analysis, I only looked for 10 years. And I find that all of these programs will be producing, to varying degrees, less use of supplemental nutrition, food stamps, less welfare use, and more jobs and higher tax revenues, which actually makes up for about 40% of the extra spending, is immediately balanced, through reduced other forms of government spending and increased revenues.
So to much of our audience, it won't come as a surprise that government spending can often long term actually be fiscally conservative, right? Budget neutral or budget negative.
Yeah, especially these days because we still have a great deal of unemployment. If you compare the proportion of Americans who are working with out of the adult population with the proportion before the Great Recession started, we are short about 8 million jobs. That is a lot of suffering that's going on. When we talk about the government budget, it's great to talk about what we'll be able to pay for this, but it's even more important to talk about what are we doing to help the millions of Americans who are still suffering from the consequences of the bank meltdown in 2008.
Well, let me ask you about the sort of other side of the ledger, which is we've seen analyses done that show us how tax cuts for the rich actually increase the deficit. And that's a sort of very, very clear and concise analysis. Can you give us some other examples of policies that at their face claim to be examples of fiscal conservatism, but actually are quite the opposite in practice?
Well, if you flip over a lot of Bernie Sanders' ideas and you get the conservative counter to them, then you get exactly that. For example, cutting Head Start. Cutting Head Start saves you a few dollars now, but over the long term will lead to worse educational outcomes, worse jobs, higher rates of unemployment, higher rates of crime, higher rates of teen pregnancy, higher rates of welfare use. It costs you money if you don't educate people well. And the same for cutting back on President Obama's solar programs. These are programs including tax subsidies and some direct spending to promote solar energy. Well, if you don't do it with solar energy, then you do it with fossil fuels, and that leads to the loss of the state of Florida. It may seem fiscally prudent to not spend money on combating global warming, but if you do that, you'll be spending more money on heating through fossil fuels, and you'll be degrading the environment and raising the sea levels.
All right, setting the record straight on that Wall Street Journal piece about the cost of Bernie Sanders' proposals. We've been speaking to economist Gerald Friedman from the University of Massachusetts. It's always great to have you on.
Thank you for having me.